Hi everyone, good morning, good afternoon, good evening. We want to welcome you to this technical help chat. It's a little bit different than a regular webinar, but hopefully we can try it out together and see how it works. I'm going to introduce my colleague Joyce Marangu from Aga Khan Foundation, who will introduce our panelists. Over to you, Joyce.
Thank you, Shikufe. Hello, everyone, and welcome to today's technical health chat. And this health chat is organized by the Aga Khan Foundation, Aga Khan University Institute for Human Development, ECDAN, UNICEF, and the Lego Foundation. And the topic for today's health chat is building the capacity of frontline workers to deliver playful parenting. So on today's panel, we have, I'm privileged to introduce to you Dr. Aisha Yousafzai, who is an associate professor of global health at the Harvard T.H. Chan School of Public Health. We also have Professor Mina Abubakar, who is the director at the Institute for Human Development at Aga Khan University. And last but not least, we have Maria Paula Reinbold, who is the Education Officer, UNICEF Latin America and the Caribbean Regional Office. So thank you all for joining the technical help chat. You have submitted a number of questions and case studies on the capacity building for frontline workers, which we will be addressing today. And if you have any further questions, please put them on the Q&A box at the bottom of your screen. And yeah, so continue to introduce yourself to everybody using the chat button at the bottom of the screen. So without further ado, I will hand over to Shikufe to take us through the questions. Welcome, Shikufe.
Thanks, everyone. And my colleague Radhika from UNICEF will also co-facilitate this portion with me. So let's jump right into it. The format will be, we have 1 hour together. We have our 3 panelists. We have over 200 questions and cases that were submitted, which we've gone through and selected a handful. There will be 4 themes. One is on capacity building. The other one is on digital and remote modalities. The next is mental health of frontline workers. And finally, the 4th one is on systems. For each of the sections, we'll ask a couple of the questions that were submitted, and then we'll also open it up to the floor to you to ask your questions. So if you do have questions while we're asking questions on the topic, please feel free to type them in the Q&A chat or raise your hand and we'll invite you to ask. All right, panelists, let's get started. So we have a case that has been submitted to us from Malawi. It says, in resource-constrained regions such as ours, human resources in the health sector remain a big challenge with about 65% vacancy rate in some institutions. Challenges also exist in that at times there are staffing rotations and movement. This poses the risk that there is a loss of memory since the staff previously trained are gone. How do we manage this? How many trainings can be conducted per facility per year? And also bearing in mind that most of these are funded by implementing partners who often have a particular time frame to adhere to. Yes, so how do we find ways around staff turnovers, relocations, and other human resource constraints? All right, panelists, just unmute yourself if you have a response to it and let's just jump into it. Let's have this conversation. So what do we do about human resource constraints? Maria, Amina, Aisha.
Hi, Shikufe. Hi, everyone. Perhaps I'll start, and then I'm sure Amina and Maria have more to add from their experiences as well. So this is a very real challenge and one that is universal and globally shared with across many countries, many partners. I think often a multi-pronged strategy is useful. So we have a lot of rich experience of training frontline workers, and that is the challenge when there's high staff turnover. So thinking about who else within the system we should be training to retain that knowledge and to be able to become master trainers over time is perhaps where some of our attention is needed, whether that's supervisors, whether that's managers within the health system, whether that's nurses within the primary healthcare facilities, but thinking about creating that sort of central hubs where the training knowledge, the skills knowledge is retained. I think that is one core piece of it. I think another core piece of it is making sure information gets to communities in different ways, not just through the immediate health worker in their catchment area. So having large-scale behavior change communication, whether it's text messages, whether it's some sort of campaign that allows parents to visually see, to remember some sorts of activities that they can try directly at home as well, because that's our end goal, to get the parents to be able to be aware of the many things that they can do, particularly if there might be a gap in the services they receive. And finally, I think that as a community, we need to be thinking about systems level research and how we advocate and communicate the human resource issue at the health sector level. Because I don't think this is something that can be tackled at the front line alone.
Thanks, Aisha. Thank you for that very rich response. Amina, Maria, do you have any specific examples of how you've experienced this or know of examples that have tackled this? And I also encourage all our attendees, if you have examples and knowledge, to share in the chat so that we're all having this conversation together. Go ahead, Amina or Maria.
Hi, Shekfe, hi, panelists and the attendees. So I don't have a specific example of how this have been tackled, but just to add on to what Aisha has said, I think the key to this is really sometimes to understand what's the cause of turnover and high attrition. What is it that motivated people to join in the first place, and what makes them leave, and really try to create conditions that encourage people to stay on. Working with some of the volunteers who work either within the ECD sector, the health system. So part of it is they really join because they believe they're going to have an impact, they believe they will be respected, but then they find that the working conditions and the situations sometimes don't meet their needs. And therefore it's not just about funding, although I think funding is also really, really important. It's important for them to be insensitized, to get incentives for the work they do. So I think part of the work Aisha has said in terms of understanding the system is really to have more work, looking at what brings people in to try and become frontline health workers, and what are the conditions that really contribute to this high turnover, so that we can have, very targeted interventions to stop this. Thank you.
Thank you. I'm going to ask Katima Ibrahim, who has posted a question in the Q&A, which is very relevant. Katima, do you want to unmute yourself, introduce yourself, where you're calling in from, and just ask your question live?
Hi,
Katima?
good afternoon from South Africa. I'm Katima Ibrahim. I run an early childhood development nonprofit organization in South Africa. We have started doing work with our Department of Health on training community health workers on early stimulation and parent support to the families that they serve in the first 1,000 days. We experience a number of issues as community health workers are employed through other NGOs on a contractual basis to the department. And in this way, the department doesn't have that direct relationship with the community health workers, but also contracts get renewed every year, which is a huge burden. So it's just our experience. It seems that our government doesn't see community health workers as a part of their core way of delivering health services. And I just want to understand if there's been examples of where governments have restructured their system to include community health workers as a part of the core offering to the country.
Thank you, Katima. Over to you, panelists.
Thank you so much, Fatima, and good morning, everyone from Panama. I just want to say something related with the previous question, and then I can give some ideas about what you're asking, Fatima. And I do believe that training gets more interesting when there are different frontline workers from different areas. So something that we have been doing in Latin American region, especially in the Central American countries, is that we ask, as soon as we get into a country, we ask who in the community is working directly with families with young children. So the answer could be a different range of professionals, no? So we can include health workers, we can include child protection workers, we can also talk about WASH colleagues. So in that sense, what we try to do is we try to train like different professionals, so they will, during the training as well, they can share their knowledge and they can see how all of them, they have a common interest in child developing in a holistic way. So that's something that it can help, like when you need to like get more strength from different areas, no? And we can all start saying like similar messages, especially talking about areas so important like stimulation or learning in the first few years of life. I don't know if someone wants to add something like related with this, and especially with the question with Fatima.
Aisha, Amina, do you have anything to add? No. Go ahead.
I understood Fatima's question was, are there other systems where community health volunteers or workers are part of the government system? So like in Kenya, they are considered part of the Ministry of Health. So the community health assistants are paid, I think, a stipend, but my understanding is the volunteers don't get, but they get a standard set of trainings. And when a project comes in and they would like to work with them, they have to go through their supervisors and get a good, so you are allocated based on what they're already doing, trying to control what they're trained on, trying to ensure, at least in the areas I'm working in Nairobi and Kilifi, because also there's a devolved government process. Yeah. So to answer our question, yes, in a place like Kenya, they are considered part of the health system. They are provided standard training and certified before they become health volunteers. Now it works well in certain ways and sometimes not so well because they are not remunerated and different projects will support them depending on what they have. Then it means when they leave or if they don't get support for that work, they may not continue implementation.
Go ahead, Maria.
No, thank you, Amina, for saying that. But we have a very nice example in Dominican Republic, and is that like there's an NGO who has a presence like in all the country. So what the Ministry of Health does is that they also support itself with volunteers that they reach families with young children and pregnant women. So what we do is that we help, like in this case as UNICEF, to train this NGO so they will also support the work of the government. And Fatima, I understand through your question that sometimes is complicated because the rotation of professionals is very high in multiple countries. And in some ways we can keep advocating for better conditions for professionals. However, what I think is that every time that we train someone in an approach like care for child development, that person will, it doesn't matter where she is or he is going to keep working with families and children. So it's like so we have this idea that, okay, we are gonna keep working with this. What we need to try to do is like to keep constant training, no? So we can help the multiple frontline workers who are coming and to help and to keep advocating so we can have better conditions for everyone.
Thank you. And I just want to draw our attention to some really valuable examples that are being given. One is create a system of peer leaders, mother, parent, champions, so that gradually we build the workforce within communities, and other ideas. So I just encourage us to keep conversation going in the chat as well and sharing your experiences. But please select all panelists and attendees so that everyone can see your question. Related to this is a systems level question also from Malawi. It says, we have worked with volunteers whose existence depends on donor partners. It has been a challenge ensuring their maintenance, as partners can choose when to let them go or make changes to their roles whenever they can. This creates a break in the foundation that was already laid. How can we maximize an existing government salaried staff to provide the services without creating an environment in which they feel they're introducing new tasks that will overwhelm them? I'm sure you all have experience with this.
I can jump in. Or do you want to go, Aisha?
Just jump in, guys. This is a conversation between all of us, so the panelists can even speak to each other.
Go ahead, Aisha, please.
So a concrete example is when we introduced CCD to community health workers in Pakistan, one of the things we did was try to introduce in the trainings how the introduction of play and communication, as well as responsive care, aligns with the work that they're already doing with families. So aligns with the work that they're already doing in nutrition, for example. How being responsive is important, not just when you play with your child, but also when you feed your child. And how a playful, active child is also a healthy child. So getting people to see how these messages complement one another is a key part of the way that we introduce CCD into existing services.
Thanks, Aisha, for that. Yeah, go ahead, Maria.
I was thinking that sometimes what happens through frontline workers is that they feel frustrated because they see that families are coming over and over with similar situations. So what happened with CCD is that they learn or they remember how to approach families in a more caring and respectful way. And when they start seeing the change of the behavior in the mother, the father, of the caregiver, they start also feeling that the work is getting more, like, it's getting better, no? And the child is getting better and the caregiver is feeling better. So when you add a very small activity of play and communication, that you are there with them and you say, okay, what about if you try this very simple activity with an object that you have at home, and we'll see what happens. And when they see that something starts happening between the caregiver and the child, they also feel that the work is worth it. So I think this self-satisfaction that the frontline workers start feeling when they start applying care for child development creates an impact. So they also feel more encouraged to keep doing it. And as Aisha was saying, I think in cases like Peru that you can find in the Nurturing Care website, a case study about how they include CCD into the existing visits to measure like the height and the weight of the child, no? So it's already what they are doing. What they do is that they change a little bit some of the approach to the caregiver. They recommend an activity that sometimes is going to take just 5 extra minutes, and they start seeing the change, the frontline workers. So that gives them more courage to keep doing it.
Thank you. Aisha, are you going to add anything to that?
It was only to comment on Maria's comment that when health workers are experiencing the intervention, they're seeing that instant change, and that in itself is motivational. It's something that's a little different from when you're giving physical health advice or or nutrition advice. You don't always see the immediate change in a child, but with CCD, you're seeing the caregiver, the parent, and the child play together, and you're seeing something instantly happen. And that in itself is very motivational.
Thank you. I'm going to go to a question from Pam Picken that was submitted, and I see you online, Pam, so you can unmute yourself and add to it, but I'm going to read the question you had submitted. How do we get this embedded in our health systems with the necessary mentoring and support, especially for community health workers working in deep rural communities with little formal recognition, support, training, or remuneration? Pam, I don't know if you want to introduce yourself and add more to that question or more context for that question.
Hi, I think it wasn't my question. I'm not sure how it came up for me, but it's certainly one I'd like to ask. And also just to strengthen what Maria was saying, we found in our work that equipping the community health workers with a small and simple toy kit completely changes the approach, not only from the households, but also from the community health worker, in that they are seen coming to deliver hope and fun and play and positivity. And in that they can still focus on the core health work, but it lightens the mood, and it helps them to be able to model playful parenting in the households that they visit. Thanks.
Thank you, Pam. Through Care for Child Development, we can reach the most vulnerable families. This can apply to every family and every child, because we are going to the roots and how can we support the caregivers to develop these skills so they will be able to learn, because the adults, they are going also through a learning process, like the abilities that they need to respond in a sensitive and responsive way to their kids. So for the frontline workers who are reaching families in rural communities and in very challenging environments, I think another question that we can ask ourselves is how can we make their lives more easy, no? Especially because they are going through like the remote areas with very limited resources. So this is the counseling card that we did for the LAC region. And this tool is a very, very simple but powerful tool that a frontline worker can have in their backpack and they can carry with them. So when they are in front of a family and maybe they forget, okay, what type of activities do I need to give for a 6 months old child? I will go very fast to this. And I said, okay, I do remember. No, I do remember. I can give this very simple orientation to the family and they will be able to practice with me and I will be there. So when we are talking about items at home, it's also a very powerful message, because we are saying to caregivers, like, you have items at your house, at your home, that we just need them to be clean and to be safe, no? But you can make them, and it's gonna support the brain development of your child. So if we help the frontline workers, like with this very simple but when I said simple, I say it in a very respectful way. It's like very powerful tools that they can use and they can integrate into already their work, so they can be able to support the most remote and vulnerable families.
Thank you, Maria. Okay, I want to turn our attention a little bit to another important component of systems building, which is how do you measure the impact of capacity building workforce and development? And I noticed in the chat there was another, oh, no worries, Amina. I just want to highlight another question, which was from ML Aguirre, who asked what tools are being used by frontline workers to measure the impact of playful parenting interventions. So questions about measurement of capacity building of the workforce. Aisha, Amina, Maria, over to you.
So there's lots of different ways that you can measure the knowledge, the skills and the attitudes of the frontline workers as you're building their capacity. So one way is through qualitative work, just interviewing, getting feedback from frontline workers about what skills they feel more comfortable with, what things that they still need support on. And these help us to identify from the frontline workers themselves where they feel stronger and where they feel weaker and where they need more support. Also, I think that we often see this term of supervision checklist being used, but we've got to use it in not just a way to collect data, so not just monitoring whether the frontline worker is making the home visit, but what skills are they applying when they make that home visit? And based on that, what inputs of support do they need from us? So I think one thing is to observe, ask the frontline workers and observe the frontline workers about their growth in their skills, but also not just to use this to measure impact, but use it to think about ways that we can boost their skills through further supervision, further training, so that there's a feedback loop between the data that you're collecting and how you're using that to help frontline workers.
Thanks, Aisha. Golam, Kibriya, you had a few questions on measurements, so please feel free to unmute yourself, introduce yourself, where you're calling from, and ask your questions live. Golam?
Hello. Hello.
Go ahead, Golam. Tell us where you're calling from. Yep.
Yes, this is Golam Kibriya from Bangladesh. Currently, I am working for Educo Bangladesh. Educo Bangladesh is a active member of Child Fund Alliance in Bangladesh, working for children. Especially, I am working in ECD and primary education part. Actually, today I am attending here in this webinar because of Aisha. I am a well wisher and I know Aisha. I met in Karachi in a workshop, so I am a very much actually interested to hear from you people now. I'm not actively participating. I just listening your lessons, and as I am working even in during the COVID period in Bangladesh in the community with the community, so we are facing many difficulties, especially to run the early childhood development program where the vulnerability and disadvantaged people are there, and their internet IT facilities are very poor, only 30 to 35%, and many people are isolated due to COVID. Even our frontline staff, and they are not reaching them because of home visit is only the way to reach them in most of the case. So it is very difficult to reach them, train them, and I do believe that if the trained mothers, parents, caregivers are aware, trained, the young children ultimately will be benefited from them, through them. As we are working in ECD field from 3 to 5 years children, both community-based centers and family support-based intervention. So
That's
what I
great,
want
Golam.
to,
Can you ask your question? Wonderful. Could you
so
ask your question?
my question is just during the COVID, we cannot actually even reaching our frontline staff because the internet facilities and ICT facilities are very poor in the isolated and disadvantaged communities. So how can we actually reach them through what are the basic tools may we use during the COVID to reach them, to aware them, to train them? These are our actually facing problem currently due to COVID. So this is
Thank
my
you.
simple question. I am with you and listening actively from you to learn something new. Thank you. Thank you.
Thank you so much,
And
Ghulam.
I am sure.
Go ahead, Aisha, Amina, Maria. Any responses to Ghulam's question?
No, I think that this challenge during COVID about how to reach frontline workers is really, really difficult, especially where internet access and the things that we might rely on in maybe more urban areas is less of a challenge. But we, in Sindh, in rural Sindh, we ended up last summer during the sort of, as we were emerging out of lockdowns, we developed a lot of home-based learning kits, which we distributed to our frontline workers. It's not exactly the same, but it allowed them to at least review and build knowledge for a time when we could bring them back together again. But I'm not at all saying that that's the solution. It's just one step that we were able to do when we couldn't reach them in any other way.
So thank you, Aisha, for your response. Do you want to say anything, Shekufe?
No,
Okay.
go ahead, Maria.
Okay. No, I was just thinking that in the last year, we needed to adapt what was happening, no, and how to keep providing services, but in a more, we can say, innovative or alternative or like different ways. So what we did in this region, in the Latin American Caribbean region, is that we got a lot of the elements of care for child development, and we enrich different responses through some of the elements of CCD. So one of them was we developed a guideline, like a toolkit to provide telephone support. So in the telephone, like when we were calling the parents and we were calling through the different frontline workers, the caregivers, like some of the advices and some of the recommendations were based in care for child development. So we got like the counseling card, we got the checklist, like a lot of the elements, and we did it. Another way was like we developed a virtual assistant that it was implemented in Peru and Bolivia, and it was like a chat box. That means that it works through Facebook. So the caregivers, they will go to this like chat box or something, and they will ask questions about their children, and the tool will respond to them. So in that case, like a lot of those answers were based in care for child development. And also like when like different countries, like when develop like through television or radio recommendations, they were also based in the recommendations from CCD. So it's like we say that it was not exactly the way that we have been implemented, but it's so rich and it has so much content, useful and practical like elements, that it was easy to enrich some of the responses thanks to the knowledge that the package of CCD has.
Okay, wonderful. I'm going to hand over to my colleague Radhika for the next half of the session to take us through. Over to you, Radhika.
Great, thank you so much, Shekufe. I'm seeing a lot of questions in the chat and also from the questions that came into us at the time of registration on the mental health of frontline workers. So how can we build the capacity of frontline workers, and especially in context of conflict or in the context of COVID, where they may be overwhelmed to deliver appropriate practice? So how can we support their mental health? as this is something that is, I think, increasingly being identified as a need, but perhaps hasn't been as prioritized in recent years. So I want to open it up to the panelists just for their thoughts on this. And I'm also seeing some questions in the chat from Evelyn and I think Claire. So if Evelyn and Claire, if you would want to come in as well, please feel free to do so.
Okay, maybe I can just try to say some of the experiences and some of the thoughts we are having around that. So actually, we just carried out a study that looked at impact of COVID among children in the first 5 years of life. And we talked to caregivers, we talked to service providers, including, the frontline health workers, including community health volunteers. And actually mental health issues were really at the top of everything. And for us, for instance, the community health volunteers were part of those who contributed to tracing and, identifying families of people with COVID, handling the corpses and all that. So I think we've been thinking about it in various ways. One of the ways is really to start training them on some of the packages where they can give each other peer-to-peer support. So we know there is growing evidence on potential for task shifting in terms of mental health, so peer-to-peer support, but also actually part of what is happening here is a lot of teletherapy and counseling, and many of the CBT modules, cognitive behavior therapy modules and interpersonal therapy modules are really amenable to teletherapy. So I think those are two areas that are emerging to be very important with potential for, for scaling up. But of course, what it needs is a lot of careful training, a lot of mentoring and supervision so that we don't really implement mental health interventions without proper training by those providing it. And I think UNICEF has developed a package that is currently being tested on care for the caregivers. And I think it's really would be useful for also frontline workers. Thank you. Sorry for the background noise.
Thank you, Amina. Yes, Maria Paula Aisha, would you like to come in on this? No? Okay. Evelyn, I just wanted to see if you wanted to come in with sharing any of your thoughts on mental health of frontline workers, just because I know you've worked on this a lot and also raised some good points in the chat.
Hello, everyone. Yes, I think mental health is something that we have come across a lot, having had the opportunity to implement CCD in our HIV programming. As much as we could not diagnose the mental health, but there were signs that you could read from the mothers. They were withdrawn, not interested in the. So you find yourself asking then how would they be able to take up the counseling that was being provided for them so that they can go support this HIV exposed infant back at home. We are also fortunate that in Malawi, thanks Amina for mentioning the careful caregiver package, we are fortunate that in Malawi we'll also be able to take part in that exercise. So hopefully going forward, we may be using that tool to address some of these maternal mental health issues. Just hoping that maybe there can be other things to use while we're waiting for this package to be fully validated. Thank you.
Great, thanks, Evelyn. I'm seeing a lot of different questions, really interesting questions coming up. And I'm seeing a few on children with disabilities, which I'll go to in just a second. But while we just touched on COVID recently, I wanted to just open it up to the panelists to share any thoughts they have on how to implement interventions such as CCD in the context of COVID, where the opportunities for gathering in person is not always possible. I know a lot of organizations have been forced to now switch to remote online platforms, which is a whole new learning experience, something that we at UNICEF are also learning to deal with. So it would be great to hear from Amina, Aisha, and Maria on their experiences just with online and remote trainings, as well as the delivery of services online as well.
So I already put in the chat some of the resources that we have been doing, like especially I put the toolkit that you can have a look if you are interested on how to prevent violence through telephone calls. And that also, it was like one of the strategies that we did to keep supporting frontline workers and caregivers in these challenging times. And also like the other resources, like how can we, like our colleagues in Paraguay is a country in South America, and they developed a beautiful campaign a couple of years ago that the name is Toys for Life. So this is, I'm gonna put you in the chat also the videos, because they are very inspiring, no? In what type of activities can you do at home, no, with the resources that you have, and why is that important? So what we did is like we went to all those resources that we had also in the past that was based in the knowledge and that we got from Care for Child Development. So we also scaled them up. So I'm saying scaling up is because we didn't put those in television, massive television, but we used those resources to use it for other countries. So the parents, they got inspired and they were able to keep supporting their children at home. And this is some of the examples. Aisha, I think you have more.
I just wanted to add a key point, building on the examples you've shared. During COVID, one of the things that everyone observed was the increase in the mental health needs of both the frontline workers, which we've been discussing, but also the parents themselves. And so in addition to thinking about the playful learning that we need to engage our young children with, it's important to also have tools ready to also support the parents and the other caregivers. And I just wanted to flag, and I think perhaps members of the team are also on attending, but UNICEF and partners in South Africa at Wits University have created Caring for the Caregiver package, which complements CCD in attending to the needs of caregivers. And there's a series of practical tips that has about supporting caregivers during COVID.
Thanks, Aisha. And I'm just going to put that into the chat, a link to the Caring for the Caregiver package, so that people can also take a look at it. Okay. So moving on, I wanted to touch on a question on children with disabilities that Ranilo has put in the question and answer section. Ranilo, would you like to come in and share your question? Not, I can just read it out. Oh, go for it.
Hi, it's 10 o'clock here in the Philippines. Yeah, I'm Ranil. I'm working for a non-government organization here in the Philippines. We've been working for children and youth with disabilities. So I'm just wondering if anybody from the panelists or the participants have this experience in training families of children with disabilities to do the home-based intervention, so that the families will be empowered, that they will be the one to give intervention, that they will be the one to be the center of the intervention, not depending on the professionals and those people outside the families. So that's my question. Yeah, because currently we are implementing that kind of program here in the Philippines. So maybe you have also other thoughts on how we can help each other, on how we can enhance each other's experiences. because we really focus on empowering the families.
Thanks, Ranilo, for that good question. I know Maria Paula wanted to come in, and they've been doing a lot of work in Latin America on this topic.
But so Amina, after you.
Sorry, Amina, first. Yeah, go ahead.
Okay.
I didn't see you
thank you. So we've had experience actually implementing the WHO program called CARE, Caregiver Skills Training Program, whereby we have lay workers training families on how to address challenging behaviors for their children, how to improve communication, and many other skills. This program brings parents together in group sessions of around 12. It also addresses mental health of the caregiver. And the experience was that parents were extremely receptive of it. Because of various things, they could actually start seeing changes. They learned things that they, like one parent said, they really had not thought that their child was capable of anything. But when they started seeing the child could pick simple skills, they were very motivated. And many parents, when we finished the first phase of the program, came back to us and said, can you please give us the manuals, trainers, so that we can support other parents of children with disability. So yeah, so there are programs out there that are well received by parents when they're trained to support their children with disability.
Thank you so much, Amina.
Thank you, Amina. And thank you, Radhika and Ranilo, for asking that important question. So in 2016, Latin America and the Caribbean had a very important public health emergency caused by the Zika virus. The Zika virus was spread around the region, and it has different implications, but some of them is that the women that were pregnant and they deliver their babies, a lot of their babies, they were born with different type of disabilities. So when UNICEF and WHO, I saw Jane Lucas there. Jane, thank you, because she was amazing to help us in all of this. So when we start preparing the response for the Zika situation, emergency, so we realized that we needed to work first, to make stronger the inclusion agenda, children and families with disabilities has all the rights, like every other child in the world, and also to attend the needs of the caregivers. So when we start this session, we start talking about how the adults and how the caregivers, they also are in a learning process when they have a new child. So the caregivers with children with disabilities, they also need to learn many things about how to respond to their children in a sensitive and very caring way. So that means that they will be able to see the clues and they will be able to respond in a very responsive way. So Care for Child Development is perfect for that, because Care for Child Development can be used for any frontline worker. So it could be for the health worker, for the child protection worker, for education, social protection. So because what we do through that is that we, like the frontline worker, understand how they can support the parents in their learning process too. So the parents, they are also able to attend the needs of their children. And when we are talking about children with disabilities, so this is a major issue, because they will need to be able to learn even the most small clues of the child. So CCT was a key element to respond to the inclusion agenda in the region, but also to support in a direct manner to the frontline workers, because some of them, they didn't have experience working a lot with children with disabilities, and also to the families. And in our case, we didn't do changes in the package or in the orientations or anything. It works for every child. So in countries like Paraguay, like some of the items that you can find in the kit, that they did it like better in the sense that they put buttons so the child will be able to have more senses. Like they adapt like some of the toys, but it was exactly the same package for everybody. And it was a wonderful experience for us. And so I encourage you to use CCD for families and frontline workers who are working with families with disabilities.
Thank you, Maria Paula. Aisha, I see you've also shared some comments in the chat box about how Umid in Mumbai has also used CCD for children with disabilities, as well as there's been some experience in Malawi as well. Did you want to come in with anything more on that, on those specific cases?
No, I think we can provide the links to the organizations in case people are interested.
Yes, definitely. And I see there are questions about sharing the resources, which we'll definitely be able to do at the end, along with the recording of this session. I do also see some questions just on play, the importance of play and stimulation. And I know even at the time of registration, we got a lot of questions about how do you work with parents who might see play as a waste of time, especially for very young babies, who, yeah, they may not see play as being very important. So just a question to the panelists, how would you work with frontline workers to help them encourage parents to engage in playful interactions with their young children when they themselves don't really necessarily recognize the importance of play?
So we had positive experiences in different settings in Pakistan and in Tanzania and in Rwanda of implementing adaptations of CCD. First of all, the important thing to remember is it's a very practical intervention. So we're not just sharing information. We're not telling parents you should play with your child. We're supporting mothers and fathers and other significant caregivers to try out activities with their children. And in doing so, they experience that reaction from their child. They're able to respond to their child. And so they're learning through that practical experience, and they're also engaging in the emotions of that experience. And I think it's important to let this be driven by the practical rather than by telling parents what to do. And often we find that parents become very motivated. We also had some very practical sessions in groups with parents explaining why learning matters from the first moments of life. And we had images that families could relate to. We used traditional proverbs, traditional cultural stories that people could relate to, because often what we find is that play happens everywhere, and these are rooted in the traditions of different communities, just how we talk about it and the examples we use and how we link it to people's own histories, their own cultures, is really, really important in how we introduce playful learning. But what it absolutely isn't is just telling people this is what you have to do.
I like that. Thanks, Aisha, so much for that. Maria Paula, Amina, did you want to come in on that as well?
I just think that it's a very powerful way, so the frontline worker can be the like the partner of the caregiver, like the partner, they will be there for them. No, it's a process of discovering. And when we talk to children or families who are in a more vulnerable place, so I don't know, children maybe with disabilities that maybe they born earlier, premature, or when we are talking about like adolescent parents, no, it's like all these processes of discovering of their child, their children. So if the frontline worker is there for them, and in CCD we learned that it's better for everybody, no? And it's like, and as Aisha was saying it perfectly, is to be there to learn, like to be there through their learning process, no? It's like, I'm not gonna do the activity, you will do the activity, you will discover your child, and I'm gonna be here with you because you are not alone. I'm the frontline worker working with you, so go ahead, I'm here for you. You can touch your child, you can discover each other's faces, like, and I think that's a very powerful thing about CCD.
I think the other thing goes back to something Maria said earlier on, which is the empowerment piece of this. It's really important to for parents to see what they can do for their child. It's not just something the teacher does when the child goes to school, or something the doctor does or the health worker does. And especially it makes, when we acknowledge what caregivers do as frontline workers, it's also really important for them. It boosts their confidence as well, because they see it's not something that has to be done by the expert coming to their house. And often it might even just be reinforcing the good things they're already doing, but somebody is seeing it and somebody is highlighting it. That's also really important.
Just maybe one comment, which is just to overemphasize what Aisha has said. I think it's so important to tap into the cultural knowledge, you know, and make proper adaptations. So the principles within CCD and ensuring, you know, you get examples and adaptations from the community will really make a difference in how it's received and how parents accept it. So I think that's really a very important point we need to keep emphasizing as we scale it up.
Definitely, thank you. I know some of the participants also wanted to come in on this, on the topic of play and engaging parents to engage in play with their children. Anju, did you want to come in? I saw your hand raised, so I'm just gonna unmute you and see if you wanted to come in.
Yeah, hello everyone. I'm so happy to share my experience here from here, India, the Albag, Agra, which is this heart of India. And here the way of life in this colony of consisting of 3,000 to 5,000 residents, and the neighborhood is all inclusive of early childhood development augmentation programs and safety and security issues and parenting issues and counseling. So I wanted to share the Dialbag model of ECDN, CCD, and the education of pre-primary group, which was very successfully implemented even during COVID year, because here there is a 6 to 8 hours every day. Everyone from the community spends in selfless service on the agricultural farms. They work together to produce the crops. So they bring their small little children from 3 weeks to 5 years also, and the old age people also come from with families, and they group together and work for self-sufficiency and selfless service to each other. So that environment is a natural, inbuilt, all-inclusive, stimulating environment for little children who spend 40 hours a week in nature, experiencing Mother Nature and experiencing the community work. And I'm, as a pediatrician, I'm looking after their health so that they are, protected from COVID. So we practice social distancing, mask, and sanitization at each and every step, because this daily intermingling of community, but it is because it is outside the house and everybody is coming at one place, different fields and different farms and farmlands. So it provides a natural environment which is inbuilt and all inclusive of ECD. And I've measured it for 4 years using standardized tools like Stanford Binet intelligence scale and Bailey scale And even now we are using CredEye and IDELA. So the outcomes are very encouraging, and want to share the whole model if anybody from ECDAN permits me. I'm trying for a lot of time. It is a practical example of how we can implement in actual sense. So thank you for giving me this opportunity, and I want to share the full video and the presentations if ever you're comfortable giving me any chance. I'm a pediatrician here looking after thousands of children from this community.
Great, thank you so much, Anju, for sharing that. I know we're completely out of time, and this session has just gone by too quickly because I'm seeing a lot of great questions, both that came in earlier and in the Q&A box. Just to wrap up, I guess I just wanted to open it up to our three panelists once more. If there was any final comment you wanted to share just on the importance of building the capacity of frontline workers to deliver CCD, if there's anything that you wanted to bring up that you didn't have a chance to bring up yet. Just wanted to open it up for final comments from each of you.
Just, there's been such a wealth of knowledge and experience around the world that if you haven't yet used CCD or you're in the early stages, I would recommend reaching out to someone in your region that has, that you can learn from and build a group of peer support as you're starting to roll out. Because for me, it was so important to have, I mean, I worked with Jane Lucas helping me all the way. And I think it's important to have someone help you and guide you in that early phase.
Thanks, Aisha. Maria Paula?
Yes, I echo Aisha. I think the union is very important, and then CCD is, we are having right now a global discussion, no, with implementations around the world. So it's important to learn from other lessons. And so if you can reach to your colleagues in UNICEF or WHO or NGOs that you know that they have experience working with CCD, will be very important. And in Latin America and the Caribbean, we are very grateful with CCD because it's being very useful for us, and it brings like many different elements of the nurturing care framework, what is so important for us to guide for this for the holistic approach for child development. So we encourage you to read more about it. If you have any questions, please reach to us, and that's it. And thank you so much for joining the session today. It's been a pleasure.
Thank you, Maria Paula. And over to you, Amina, for your...
Thank you. I think what I can say is just to echo what Aisha and Maria have said. The CCD is a very useful, resource that many frontline workers can use to, implement programs and integrate it within different systems. I've seen it work in many different systems. I think to really get a good impact for it, proper planning in terms of mentoring, supervision, and ensuring high quality. And as Aisha says, learning from those who have done from your region can really make a huge difference in outcomes. Thank you.
Thank you so much. And I just want to wrap up by giving a big thanks to our three panelists, Aisha, Amina, and Maria Paula, for making the time to share their expertise with all of us. As Maria Paula mentioned, we are always looking to learn more about how different countries, different organizations are implementing CCD. So also just wanted to thank all the participants for sharing their experiences as well. I think we're definitely going to plan to do more of these help chat sessions just to continue sharing lessons learned, sharing experiences with each other, because I think this is a great way to continue learning and continuing to improve our work. So thank you all so much. We will be sharing the recording with all of you very soon, along with all of the resources mentioned today. And we will be planning to have more help chat sessions and webinars in the future on this topic and on similar topics. So Looking forward to engaging with all of you again soon, and just wanted to thank again all of the panelists, all of the organizations that helped put this together, including the Lego Foundation. And yes, wishing everyone a great day or evening ahead, and looking forward to connecting again soon. Thank you all very much.